Are we good, Aaron? Yeah. Are you streaming? Yeah? Okay. Okay, gang. Any questions from lunch break that you got to think about? Anything from the front half of the horse that you had any thoughts on? No? Pretty happy? Okay, sounds good. All right, let's start on the horse's haunches here, and we'll start first, of course, with our bony anatomy, and then a little bit of biomechanics of what's happening, work our way down the leg, and then we'll talk about a little bit of nervous system stimulation. Okay, so again, my guy here is, my skeleton is just 14 hands, so he'll be a little bit smaller than our demo guy that we've got here. But let's talk about how this pelvis sits in the body, and then our very, very important SI joint, where the body is going to bring the propulsion of the hind legs into the spine. Okay, so if we pop over here by this guy. Hi, Mr. Muffin. Mr. Muffin, Mrs. Muffin. Mrs. Muffin. Okay, guys. So if we look at this horse here, and I put the pelvis up here beside this guy, we're going to look at our three major areas of the pelvis so that you guys can look at what you're going to evaluate. And then I'm going to put some tape and stuff on here so you guys can see this really well. But if we look here at this guy here, this is called our coxal tuberosity if we're going to be official, okay? Or you guys might call it your point of the hip. This is this outside of this pelvis right here. If I turn the pelvis towards you guys, we're looking here at this wide wing that's on the outside here, okay? So this is that coxal tuberosity, or the point of the hip if you guys are using your lay terms. Right up here at the very top, and this is going to be important for us because I'm going to give you guys a little bit of nervous system stimulation we're going to do here. This here is our sacral tuberosities, okay? So on this guy here, we've got these tall sacral tuberosities coming down. And we're going to talk about the SI joint in 1 second. But when we're going through the pelvis, this is going to be the tallest part of our pelvis here. Then back here, these are going to be our seat bones, or our ischiatic tuberosity. And we'll turn the horse in a minute here so you guys can see that from behind. But that is going to be these two tuberosities that we're looking at here. Let's just put the pelvis and the sacrum together. So I robbed from my spine here. I took my sacrum off. Maybe less if you want to just pull forward just a touch. Cool, thank you, sir. So I went ahead and took this sacrum off here, but when it was sitting on the spine, you would have saw that this sacrum is going to come right behind the lumbar vertebrae here, and going to be the last little bit of our spine, our sacral spine. In the horse, these are going to be all fused together. And when we talk about the horse's pelvis, we need to talk about the SI joint, okay, where the sacrum and the ilium come together, okay? This area is a problematic area for every discipline, and we end up with a lot of asymmetries in it. So it's really important that you guys kind of have a look at it here and see how it's going to sit in the body. If I hold the pelvis up towards you guys, and I'm going to come around like we have been doing to the different groups here. If we look here on the front of the pelvis, on the wings of this ilium, we will see that there's a flat surface there, and if I turn the sacrum towards you, you will see that there's a flat surface here. These two flat surfaces are going to come together, and if I hold this towards you guys, okay, and towards the guys at home, okay, you're going to see that these two flat surfaces come together, and this is what makes up our sacral iliac joint, okay? And our joints are way down in the body, way lower than most people think they are. Most people are thinking that what they're palpating from the top of the horse's croup is the actual joint surface, okay? So again, for this group over here, if my horse's head is facing you guys now and the pelvis is facing you, if I turn it up, you can see that there's the flat surfaces here on the inside of the wing of that ilium. And there's also, as we said, flat surfaces on the front of this sacrum. When those two flat surfaces come together, I'm going to rest this pelvis on this bar here. When these two flat surfaces come together, our SI joint is way down here, okay? And again, most of us horse guys are thinking that it's way up here, all right? So it's important for you guys to note how low this is in the body and where it sits in your horse's body. We also want to think to ourselves that when we're looking at our horse's SI joint, we're going to go through the straightness of it in a second and how this pelvis can move in the body. Well, when we're looking at this horse's SI joint, this joint is held together with very thick fibrous ligaments, okay? And because of that, this joint does not have much movement in it. So this joint is not meant to be a full articulating joint like we have in the horse's legs. This joint is meant for stability. Now, if you read some of Deb Bennett's work, she's going to tell us that this joint can actually move on about 42 different planes of movement, okay? So it can move slightly forward, slightly back, slightly up, slightly over, have some range to it. But again, it's not meant to be a full articulating joint because of the thick fibrous ligaments that are around it. So what is the job of this joint? Biomechanically, the job of this joint is to take the power created by the hind legs and take that propulsion and put it into the horse's spine to be able to get the horse to be able to propel itself forward with immense speed. Okay, so that's the job of this joint, is to physically take all of the torque and propulsion by the back legs and bring it forward. If this joint is dysfunctional or has pain in it, which I'm going to show you guys how to palpate in a second, then the body is going to hold this joint and is not going to be able to take that propulsion and put it through the spine and be able to actually function through the back correctly. As soon as the SI joint is sore, the horse's back can't function correctly, all right? Now, we've got just the absolute perfect hip horse for you guys here, because we do have a dysfunctional hip and SI joint, and I'm going to show you the mobility for that in a second. But what we're going to see when the joint is dysfunctional is we're going to see that the pelvis is going to slightly rotate on the sacrum here. The sacrum then can go to the extreme of tearing the fibrous ligaments that sit in that SI joint and actually create enough pain in there where the body won't want to use this joint surface. But most of the time, I'm going to think, because we don't have an ultrasound or anything of this horse, but I'm going to assume this horse, because we looked at it earlier, that it has a rotation in the SI joint without a tear. If that ligaments in that joint surface tear, then we've got an actual pathology that we have to deal with, okay, gang? So we do have to consider that there can be an injury in this joint. The thing about SI joint pain is most of you trainers will notice that the horse just isn't right. SI pain often, like 90% of the time, does not create a direct leg lameness. What it does is it seems like the horse kind of has a flat tire, okay? It seems like they don't want to push quite as hard. It seems like they don't want to use their hind legs quite as well as they used to. But it's not that they're physically limping behind. And this is really important for you guys, because I come across a ton of horses with SI pain, and everybody has said to me, oh, you know, we had the vet look, he flexes pretty good. We've had it, maybe it's hocks done or something like that to medicate a bit behind, but the horse still isn't right. It still doesn't want to use its hind end correctly, and that's where you trainers want to go right to this SI joint and see if there's something going on in here, okay? So let's go ahead and, oh, question?
Yeah, so if, like you say, the difference between, you know, it being just something that we need to strengthen and loosen, and then something that's injured. So probably your big indication
And there's no change, yeah. Yeah, and also if there, of course, is any kind of direct lameness that's happening with that horse, but I love your thought process on that. If we have a horse that just plain old is not functioning and we start a strengthening program and we get it to start to strengthen, then we're going to be pretty happy with that guy. And like you say, if we start the strengthening program and nothing changes, then we need to dig further into some more diagnostics on that SI joint and see if there's more pain in there or a tear or something like that that we need to look into. So that's an excellent point. So I've chalked on both sides of that pelvis, but I do want to just get some dots here to put down the middle of that sacrum, and then we're going to start our eval part of this. Okay, bud, let's just stick some dots on you, okay?
So I was reading about SI joints, and they said sometimes an indicator can be that they bunny hop in the back end.
Exactly, that they don't have the same retraction from side to side. They often, if there's enough pain there, will use both hind legs together, which is what you're describing with the bunny hop thing. Some guys too, I really like that terminology that it feels like there's a flat tire, because some guys just say to me, you know, it just doesn't feel like they have the same push behind that they had before. So oftentimes it can just be too that you've lost some ability for that horse to push behind. So we can have that as well. Yeah, so good one with the bunny hop. Okay, gang, so what we've done is I've chalked on your pelvis, and I'm going to show you here how I want you guys to start to evaluate your horse's hip. The first thing that I'm going to have you guys do is I'm going to have you reach up to these tall parts of the sacrum, and I just want you guys to just squeeze them together lightly. Same pressure that we've used the whole time we've been doing any of our palpating on the horse, that kind of pressure that you would go ahead and push a thumbtack into the cork board. So here I am with my fingers wide on each side of the sacrum, and I'm just going to squeeze, okay? And you can see the little bit of pain response that we're getting through there, all the fasciculation and spasming down the back that we're getting on this horse. So I just want you to squeeze those two sacral tuberosities together, okay? What are we doing when we do that? Well, we're going here to the top of this sacrum, okay? We're putting our fingers on the bone surface and we're squeezing that bone surface together. If I point this towards you guys, you will see, of course, that there's that space in between there, and you're just bringing that pelvis together like that, okay? When you do that, you are putting pressure on the actual joint surface that's down below, okay? So you're getting an idea of the reaction of that actual joint surface down below. So that's a very good one for you guys, an everyday one that you can use to see if there's any kind of SI reactivity in there. The next thing we want to do is to actually look at the pelvis itself and see if it's sitting square in the body, okay? So we need to then look from behind. So maybe we'll do the same kind of two-group thing that we were doing before, Les. If you point the butt at this side first, and then we'll, and as square as we can get this guy. And this is more of a thoroughbred guy, so he's a little bit more fidgety, but we'll still be able to get our job done here. Okay, nice, Les, fantastic. Okay, gang, so then from behind, oh, little step, he says, hey, I hear stuff back there. Can you give us a half a step back, Les? Yeah, oh, half a step forward. This is always the fun thing, trying to get the horse square when you're trying to do your assessment. Especially on these higher twitch guys that are a little bit fussier. Yeah, perfect. Okay, gang, so you want to be looking here at this sacrum, okay, and you want to be telling me, now of course he's resting this one less. You want to be telling me if one's higher than the other. Oh, good, perfect. One's higher than the other one, okay. You guys are going to have to look quick. All right, there we go. Okay, so we're looking at these sacral tuberosities. Do you have one that's higher than the other one? Yeah, this right-hand side's quite a bit higher than the other one, isn't it? Okay. Then from behind, you want to be looking at the top of these coxal tuberosities, that point of the hip that you guys would call. Oh, nice and square there. Oh. It doesn't last long. It doesn't last long, especially on these thoroughbred types. Nice, perfect, Les. You want to be looking at those coxal tuberosities, okay, the point of the hip. He's just resting this side, Les. There we go. Okay, point of the hip. You guys have one of those that's taller than the other one? Oh, oh, it's okay. It's okay, monkey. It's okay, monkey. Oh, good boy. Girl. Good girl. Good girl. Oh, she says, my thoroughbredness is coming out. Okay, we're not perfect there, but you guys have one of those that's taller than the other one? Okay. You guys see that the left-hand side of that coxal tuberosity is taller than the right-hand side? Okay. Last thing you guys are going to look at before we go to the other group is you're going to look at the muscling in here. Okay. Can you guys see that one side of this muscling is thicker than the other side? Okay. So quite a bit thicker on the left-hand side, right? So on this horse's pelvis, we have the left-hand side higher. She can walk around and have a little break from standing less, and then we'll have to torture her again for that side of the group. Okay, so this horse, we have the left-hand side of the pelvis higher. We have more muscling on that left-hand side. So when we're looking at this horse, we're going to have a horse with a right dropped pelvis, okay, lower on the right-hand side. And when the pelvis is dropped on that side, we're also going to be looking to see if the pelvis itself is rolled forward or rolled back, and we'll add that dynamic in 1 second here. We'll just get these guys to be able to see the heights. Okay, so gang, once we get her square here, you're going to be looking at the top of the sacral tuberosities. Oh, monkey. Atta girl. Okay, pretty close. Okay, sacral tuberosities, okay? You guys see that we've got higher on that left-hand side, okay? And then coxal tuberosities, which are these guys here, okay? Can you guys see that that side's higher as well, okay? And then muscling in the gluteal region here from side to side. And you guys see that we've got way more muscling on that gluteal region than you've got on this side, okay? So very asymmetrical pelvis from side to side. The next component that we want to add, so let's get the bone here so we can have a look. All right, so on this horse's pelvis, if her head is pointed towards that end of the arena, on this pelvis, we have this side high, but we also have to see if we've got some kind of rotation in this pelvis forward and back, okay?
Or it's just the way you have it drawn?
No, the right one is higher, but that's going to be from forward and back. So that's our next thing that I like where your eyes go in there, but that's going to be our next thing with this forward and back. So first we start with that we're going to look to see if one side's higher than the other, and on this horse we've got the left side higher. And now we're going to go ahead and we're going to try to evaluate how the pelvis is sitting in the body. So how we're going to do that is, and we'll have a side view for this, Les, would be great. Good girl. Okay. All right, so to be able to do this, we need to do some range of motion on this pelvis. We need to try to put our fingers up beside the sacral tuberosities and drag this pelvis forward. So she's got almost no willingness to bring this pelvis forward. Gonna get kicked. Okay, little tiny bit. Can you guys see that I can sort of get her to have a tiny bit of forward, but hardly any at all, okay? All right, and we should have full range so that I can get her to bring her pelvis all the way forward. I should be able to make that croup absolutely flat, okay, when I go to drag that forward, and she's not responding here at all. I can get to there, and that's it, okay? So then I'm going to try to bring this pelvis all the way to the back by running my fingers down here and seeing what kind of range we've got. Okay, seeing what kind of range we've got. Oh, she says that is sore. Okay, all right, one more time. Let's see if we've got any range. She should be able to tuck this bum She says, no way, sister. Okay? She should be able to totally take and tuck that bum all the way underneath herself, okay? So she has got no range forward, and she's got almost no range back, okay? So it would be interesting to see on the other horses, or when you guys go home, to be able to see what normal range is. Because when I drag the pelvis forward, and to do that, if you guys are wondering what I'm doing, I'm just putting my fingers in the soft tissue beside the spine, okay, right, starting right at that tallest part of the croup, that sacral tuberosity, and I'm just pulling my fingers forward with that, with the pressure that I would push a thumbtack into the wall, okay? And then I would want to be able to do the exact same thing backwards, put my finger in the soft tissue, and get her to be able to tuck her bum and be able to come all the way underneath like that, okay? So when I am doing that evaluation, if she's unable to do that, it's telling me a lot about how the SI is functioning, and it's also telling me a lot about the hip flexor muscle. So her pelvis right now is sitting slightly backward like that. We can see that the sacral tuberosities are poking out of the body, okay? We can see that the body has a little bit of what we would call a traditional hunter's bump. And to gain that traditional hunter's bump, the pelvis rotates slightly back like that, okay? So here is a normal pelvis sitting flat, okay? And her pelvis is rotated slightly back like that. All right, so that traditional hunter's bump then brings the sacrum, the two sacral tuberosities, and has them sticking out of the body a little bit more than they should be, okay? This pelvis on her should be sitting flat like that. So the little gray horse we had before lunch had a very flat pelvis on her, and we would know then that pelvis and the SI joint are sitting pretty balanced in there. Now we didn't do the squeeze to see if she has any pain in there, but just posturally, she's sitting balanced. Whereas this horse is bringing this pelvis back like this, which is what's making that hunter's bump up front, okay, and the sacrum. So what does that mean to you guys on a horse like this that isn't able to move their pelvis? Oh yeah, question?
I'm just wondering if that's the case where she's tipped down with the pelvis, would it cause her whole hind leg now to be camped under a little bit too much under her body?
Yeah, it would. If there was no other factors, the hind leg would sit a little bit camped under. I think we're going to find the more eval we do on her that she's slightly rolled to the outside. So I think she's got a little bit of stifle pain that we're going to come up with as well. So because she's got stifle pain, she won't be willing to totally sit like this, camped under, because the stifles are sore. And it'll be a bit of the chicken and the egg. Did the stifles get sore because she started to protect the SI joint? Okay. Or was it the stifles first and the SI joint second? So as we go down, I think we'll get a good idea of what's happening with that, with the biomechanics of the stifle itself. But if we stay with the SI joint for right now, because she's rolled slightly under like that, she has her hip flexor muscles turned on all the time, okay? And with those hip flexor muscles turned on, they come up and they attach on the underside of the lumbar vertebrae. So the hip flexor dudes, they're called your psoas and iliacus complex, okay? They come and they attach, working with thoroughbreds, okay? They come and they attach on the underside of the lumbar vertebrae, all right? When they are too tight, they start to pull on those lumbar vertebrae, and you guys are in a perfect spot to see. Do you see these lumbar vertebrae roaching up here? And then this dip that sits right here, and then, you know, our traditional peaked up hunter's bump, okay? That's being created from that tissue being too tight through there, okay, and pulling on that. All right, if we move down less, let's just point that out to these guys and the guys at home, because that would have been hard for them to see, okay? Can you guys see here from your side that we have these lumbar vertebrae starting to rise up in the body here? Okay, everything stays pretty flat till we get to this guy, and then we see these guys roaching up or rising up. Then we see that there's a lordosis or a downwards curvature here in front of this SI joint, and then we've got our peaked up sacral processes there coming out of the soft tissue. So when we have a pelvis that sits like that, the body starts to compensate in that posture. Let's start to work our way anatomically down the leg so that we can kind of see here what's happening in the bony structure. And I'll chalk this on the horse for you as you go. But first, let's just look at the ball and socket joint of the femur. So if this is our horse's pelvis, we can see that this is the socket that our horse's femur is going to fit into. And there is the ball on the end of the femur, okay? And so that guy's going to sit right in there, okay? This ball and socket joint has the availability to move in any direction it wants, okay? It can come in, out, side, side. It can do all kinds of dynamic things all the way through here. So this is going to be one of our most mobile joints in the hind leg, and very strong joint coming off of that hip. So let's show these guys over here. Okay, gang, so here is our pelvis, and there is our socket that our hip joint, or the head of the femur is going to sit in, okay? And there's that nice round, there you go for guys at home, and there's that nice round ball, okay? And that guy's going to sit right in there. And this has any direction, range of motion that you would like to have happen in here, okay? The one thing that we like to check when we have a horse with a pelvis that's this rotated is we like to check if there's any pain inside this joint where the femur meets the pelvis. To do that, all we're going to do is we're going to press straight in to the top of the femur and be able to feel that. Now, lots of people have a really hard time deciding where they're going to press, and all I want you guys to do is look from the bottom of what you guys would call the point of the hip, okay, all the way back to where your seat bone is, and if you are on that line that's there, that's where the head of the femur is going to press in. Now, if you're a little bit up or a little bit down when you guys are at home doing this, you are still going to be fine. So it's not that, you have to be in this exact position, okay? But I do want you to be on this plane somewhere through here, okay? All you're going to do is take the heel of your hand, nice flat hand, okay? And you're just going to press in, okay, to this joint. And you're going to see if there's any pain, which this horse has none, okay? And you're just going to press that femur into that joint, okay? It's going to tell you if there's any pain around that hip socket, okay? And that hip socket, if there is soreness in there, is going to be very limiting on how much the hind leg is going to be willing to do in your exercise therapy that we're going to want this horse to perform. This horse is nice because she doesn't have any pain in there, so we can focus on the range of motion in this pelvis easily without her having to endure any soreness that goes through that femoral head where the joint surface is meeting, okay? We're going to come back to our range of motion in a second, but we've got to stay focused on our anatomy to start with, okay? All right, so we're going to grab the tibia here and the patella, and we're going to talk our way through. Let's put this on less, and then that way people can see it on the horse itself. Okay, so here's the head of my femur. There's the the trochlear ridge of my femur right there. So there's the bottom of the femur on this horse. Okay, and then we're going to come right down here to the talus. Okay, so I'll get this chalked on for you guys so you can kind of follow along with where we're at. It's a little bit wide, but you'll get the picture. Okay, cool. So let's talk our way through these bones quick. All right, so we have our femur here sitting in the horse's body, and then you have your tibia coming underneath. Now on the horse, They have a little teeny tiny fibula, but they don't have an articulated fibula like we have, okay? So they just have the single long tibial bone that's in there. And then they have the same setup as we have for the patella sitting on the top of this joint surface. This joint surface is the weakest joint surface that you guys have in your horse because there is no other bony attachment to it, and the muscling that's around it often gets weak very easy, which is your quadricep muscle. We're going to talk about that quads in a minute when we start on the soft tissue. But I want to just kind of point out to you where the patella sits and how it sits in the horse itself. Whoops. Lots of people think that this patella sits in between these two joints, okay? But it doesn't. It sits on the top of the joint surface like this, has 3 patellar ligaments that come down that are easy for you guys to palpate from the outside. Okay, so coming over here to these guys to make sure that you guys can kind of see how these 3 butt up to each other, okay? So there's your femur coming down.
Could you just back up?
Yep, back up a little bit. There. Okay, so there's your femur coming down and your tibia there, and your patella gonna sit on that like that, okay? 3 patellar ligaments coming down through there, and you guys can palpate this joint surface pretty easily to feel those 3 patellar ligaments, okay? But it's important for you guys to realize how that sits in the body, because we're gonna talk about the quad muscles in a second, and they're our big nemesis of the hind legs. Okay, gang, so as that comes down, we need to be able to see how that stifle joint sits in the body, because it's very relative to what's happening in the pelvis. When we look at the way that this stifle is sitting in the body, we need to be able to evaluate if it's sitting straight in the body or if it's slightly rolling to the outside. Normally, the more problems the horse has in the pelvis and the more rotation we have in it, the wider the stifles frog to the outside to be able to support that pelvis, okay? Now there's one interesting thing that we should go through before we start on the soft tissue, and that is how the hock sits. So if we get out our top bones of the hock. Now there's stacked bones in the bottom of the hock as well, but these are the guys that attach to your tibia. So if I have this sitting here and I point the bone directly at you guys, can you see how the round edges of the hock point slightly to the outside? So here's this joint, this joint working, bone rolling on the top of that talus there of the hock. Can you guys see if I point the bone right at you guys that the hock points slightly to the outside? Okay, and that is natural in nature, and the hock should point slightly to the outside. And the reason that is because they want to be able to, so if I point this at you guys, can you see that these trochlear ridges point slightly to the outside, even when the bone's straight on towards you? Okay, guys at home. And the reason that is because the horse needs to be able to pass its viscera with its hind legs when it's in full gallop, okay? So the hock needs to be able to come to the outside of the belly to be able to come, to be an efficient runner. Okay, so those horses that we used to breed for halter, and we bred them absolutely perfectly straight. Okay, if you had those horses in full extension, a lot of those, and you can bring up all kinds of videos on YouTube where the stifles are actually hitting into the belly, okay? So a stifle does naturally, the hind leg does naturally point to the outside a little bit. But when we have horses with these kind of pelvic asymmetries, and there's some pain in the pelvis, the horse does exactly what we do with our pelvis. When your hips hurt, we clamp them in, right? And we try to lock them down a little bit. When we do that, naturally, our knees bend a little bit, okay? And lots of people with low back pain have knee pain, or vice versa. They had knee pain, so they started to have their knee bent so that it wasn't fully extended, because that's the easier way to take the weight bearing. And then when that joint surface is bent all the time, our hip flexors start to shorten and we start to get that low back pain. So when you have that low back pain and you bring your stifles slightly, or you bring your knees, I guess we call them, slightly bent, then you end up with shortening in the hip flexors and more torque having to be put on the hamstrings all the time, because the hamstrings are having to go over a larger surface area. So that's kind of interesting for us, and we see it in this horse, and we're going to watch her move in a second, and I'll put some, actually a flag will work the best. I'll put a little flag on her stifles so that we can watch those stifles move to the outside, because this is going to be a really typical SI joint pain horse. So I'm just going to stick these little flags on so it's easy to see. Good old thoroughbreds. Hey, bud? Hey, bud? Ho, ho, ho. Ho, ho, ho. All right, and then we're going to watch her walk, and we're going to watch these stifles roll to the outside as she walks. Okay, Les, so it'll probably be the best again if we went from the camera to the Wrangler side. So what I want you guys to watch for, we're going to start with the pelvis, okay? And I put those dots on the sacrum there. We're going to start with the pelvis, and we want to look, we're going to keep our eye at the very top. We want to look if she brings her hips further forward on one side or higher on one side. So we'll let her come back here. We're going to look at the top of her gluteal area, okay, in the muscling there. And we're going to look if one side goes higher or if one side moves further forward, okay? So we've got quite an asymmetry. What do you guys see? Can everybody see that that pelvis is rolling further forward to the right? Yeah. Okay, further forward to the right. All right, and then we'll let her come back here. Okay, and we also have the left-hand side, if you guys watch this time. The left-hand side is popping higher up in the gluteal region. So in that muscling region, do you guys see that that goes higher up and the right side drops down further? Okay? Okay, so that's very significant in the pelvis. Now this time when she comes back, we're going to watch the stifles. And they're nice to watch from the back, and then we're going to watch them from the side as well. I want you to watch those little flags that I put on, and I want you to watch to see if they go further width-wise than we would like, and if one goes wider than the other one. Okay? All right, can you guys see that the right one goes significantly wider on those little flags than the left one? Okay? So lots going on in this pelvis. Now, Les, if you walk her in front of the group here, we also want to be looking at the stifles to see if there is the same amount of tone or muscling above that little flag that I put on in the quad region, around that femur that I've chalked on for you, okay? We want to kind of look at that, and we want to see if one side is contracting more than the other. It is relative to how far forward the leg is coming for sure, but I like to start with the stifle and then move down to the flight path of the leg. So if you guys can see, and we'll let Les go back and forth a couple more times, if you guys can see that when her right hind comes forward, it is not able to take as long of a stride, and the stifle itself does not have as much contraction as we'd like. The other thing that we really notice on this horse is when she goes to bring the leg back, the leg itself gets stopped by a very tight quadricep muscle. You guys can even see the muscle lines being made by the quadriceps. If I put a little bit of chalk, if you stop, Les, for 1 sec, because this is quite significant for you trainers. If you watch right in here, okay, on both sides, you'll see that when the leg, okay, perfect, thanks Les. When the leg comes back, that you will see the quadricep muscle is so tight that it makes thick muscle lines from the outside of the horse, okay? So when you watch it walk, do you guys see those tight bands made by that quadricep muscle? How tight they're being pulled there? Okay? That muscle should be so flexible that that leg could come all the way to the back and allow that leg to move backwards like that. So she is so tight in the stifle region. Perfect, that's great, thanks Les. She's so tight in the stifle region that she's not even able to retract the leg as much as we would like. So now if we go to what all you trainers have probably been looking at the whole time, and I've been looking up taller, if we look at the actual flight path of the hind leg, we're going to see that that right hind is a toe first landing. We're also going to see that it lands shorter strided than the left hind. And we're also going to see a slight wave in the flight path to the side. And we're going to watch that as well on this when we go to the Wrangler sign. But let's do this one first, Les. Let's just do the reach of both hind legs. Okay? So do you guys see that she digs that right hind? She even kind of scuffs the ground a little bit with that right hind toe. Okay? And she's definitely got that, a little bit of toe first landing on that right hind, okay? And if we look at the length of the stride, the right hind is shorter than the left hind is, okay? Is everybody seeing that? Yeah? Okay, cool. Now let's go ahead and look at the flight path of the hind legs, Les, from the camera to the Wrangler sign. This time, gang, we're going to look for some hawk wobble. And we might have to tie that tail up. Let's see what we get here. But I want you guys to look at the hawks themselves, and I want you to see how much, when that hawk hits the ground, how much medial lateral wobble it has in it, okay? We call that hawk wobble, okay? So as she goes away, let's see if I'll just tie that tail up, Les, maybe if it's a little easier for everybody. Oh, yeah. Tail is often indicative of what's happening in the pelvis because it's a balance mechanism. Yeah. And so that's telling us about pelvic, the health of the pelvis as well. Okay, now that the tail's up, can you guys see that significant hawk wobble? Okay. You guys see that hawk moving like that? Now, horses with SI pain don't want to be able to bring that hind leg under the body as far as we'd like. Again, we said that the stifles roll to the outside, and all of this torque is often goes straight down to the hocks. These horses, veterinary-wise, often need a lot of hock maintenance, okay? They need to have their hocks done regularly, and I can tell you that there could be a pathology in the hocks for sure, but if this is all coming from soft tissue in the pelvis and the stifle, we can get rid of that hawk wobble by being able to gain range of motion back in the pelvis, in the hip flexors, and in the stifles, okay? So we've had tons of luck doing some nervous system stimulation exercises, as well as some therapy to get rid of all that hawk wobble. Okay, so now that we're done looking at the hocks, we also need to be able to look at the flight path of the two hind legs from behind. And we want to see that that right hind is pulled more medial when it lands, or more towards midline, if that helps you, than the left side. She tracks quite close on both hinds, trying to protect her pelvis. But can you guys see how that right hind is coming medial or towards the midline of the horse? Okay? So that as well is really telling us about how she's willing to hold her body. Horses that are protecting their pelvis and SI often come very close behind like that. and they often have problems with the ability to totally extend the leg underneath the body. So, you know, we're going to give this horse a pretty poor quality walk at the moment, but for me, it's much less about her ability to move as it is her posture that she's holding in her pelvis at the moment. Okay? So this horse for me is the perfect SI stifle horse for us to look at. Okay, gang. So now that we've gone through that, the bony landmarks of the lower hind leg are the same as they are in the front leg. So we don't have to go through that again. But we do have to talk about the ring of muscles that creates collection, because that is the other thing that's going to enable you guys as trainers to be able to get this pelvis to work better. All right? So the ring of muscles that is behind is going to start with your hip flexor muscle. Again, those hip flexor muscles are on the inside of the pelvis, and they're going to coil the loin and actually bring the loin into some form of collection or flexion, if you like that word better, okay? So they're going to bring the pelvis down a little bit. Hers are perpetually turned on because of the way her pelvis is sitting in the body. The next part of the ring of muscles are going to be the core tissue along the lumbar vertebrae and down into the spine. Now, the interesting thing that we talked about before is, remember that we said if there's muscles on the top of the vertebrae and they contract, which way did the vertebrae went? Okay, the vertebrae are going to go down, right? If we have two vertebrae here and we have muscles that are on the top of them, if the top of here and the top of here get closer together, it brings that vertebrae, okay, down like that, all right? Now, so if our next part of the ring of muscles for this horse is supposed to be the core tissue along the spine, when we ask this horse to be able to turn those on, we should see that the lumbar vertebrae get flatter. And in this horse right now, we have that roached up shape in the lumbar vertebrae, right? So that number one, with the shape, it's already telling me got a problem in there that those muscles aren't functioning, right? Because if they were functioning, that lumbar vertebrae would be straight. But it's also telling me about how strongly, okay, the pelvis is being held in restriction there. So to be able to palpate that, all I need you guys to do is to be able to go on either side of the lumbar vertebrae and just press straight down into there. Okay? Don't need to press hard, because we can make any horse flinch by pressing hard. We're just pressing down with the same pressure we've talked about this whole clinic. Okay? When I press down in there, we can see that she has quite a response. But the next time, as far as pain response goes, but the next time I do it, I want you to watch what happens to the pelvis. When those core tissues turn on, the pelvis, who is right now in that rocked back position, is going to move forward. So here's her pelvis, her head is facing that way, okay? And right now her pelvis is in this rocked back position. When I stimulate that core tissue in the lumbar vertebrae, okay, so here's the pelvis sitting in the body, minus the sacrum because it's over there, but here's the pelvis sitting in the body. Hers is rolled back like this. I'm going to stimulate the muscles that run along these lumbar vertebrae, and you guys are going to see that this pelvis is going to be pulled forward by that core tissue turning on, okay? So it's going to be a good indicator of what's weak on this horse because of the way she's standing in her posture. So watch the pelvis this time as we palpate this lumbar vertebrae. Okay, you guys see it all move forward by stimulating that core tissue in the lumbar region. So that's going to tell us, for you guys as trainers, that this horse is not able or isn't in work turning on the core tissue in that lumbar vertebrae, okay? We're missing that link in this horse's ability to get the pelvis to turn on. So that's going to be one of the the nerve stimulation exercises that we're going to use to see if we can make a change in this horse, okay? The next thing I want you guys to be able to evaluate is the stifle. So if you bring her kind of into the middle here and leave her on a side view, I'm going to take the tail gang and I'm going to pull it towards the dimple of the stifle. And when I do that, you guys are going to watch the quadricep muscle here that I put a line on. You're going to watch this stifle mechanism turn on and off. So if I'm just going to direct this here at the stifle, and I'm going to pull the weight forward. Okay, oops. She says that's not comfortable. All right, girl. Okay. Oh, man. Okay, and I'm going to turn this on. And do you guys see this quadricep muscle? We might have to turn her head a little bit that way, Les. Thoroughbreds. Okay, back to the side view, missus. Okay, this will be perfect. Okay, gang, so watch this stifle area here. Okay, on, off. Okay, on, off. On, off, on, off, okay? So that's the stifle mechanism turning on and off, all right? That's the quadricep muscle around there turning on and off, as well as the stifle stabilizer, that tensor fascial lata muscle. That is very important for you guys to look at as trainers because we need to evaluate both sides. So if we turn her around less, we'll show these guys the right side, which is our weaker side. Atta girl. Okay, so here's our weaker side. On, off, on, off, on, off, on. Oh, that's better. Off, on, off. First couple didn't go on at all, okay? So this is our weaker side. We've seen that from the way she moves, okay? And so we're going to use this exercise as well as a little bit of a nervous system stimulation exercise to see if we can make a change in the way that she's holding those stifles, okay? So to finish off that ring of muscles that we were talking about for our collection, the next thing that has to be able to turn on is our abdominal muscles, all right? So the abdominal muscles have to be able to turn on, and especially our rectus abdominis, our big flat guy at the bottom, has to be able to turn on to help the back be able to lift up and to finish the pelvic rock forward, okay? That rectus abdominis attaching from the horse's pubis, same as us, up onto the xiphoid process of the sternum, okay, on the back of the sternum, has to be able to turn on to be able to get the rest of that pelvis to move. Now I'm going to bet here that she's going to be pretty mad, so we're probably not going to be able to do it too many times, but I'm going to stimulate this, this abdominal tissue and see if she's got much range of motion through here and if she's able to turn these abs on. And I would bet that she's going to maybe have a reaction for us, so let's just watch that hind leg here. Okay. So that's about as much lift or range of motion. She's like, you're not coming at me again. It's okay, sister. We're going to make you feel better, but it's not till the end. Is that okay? Okay, let's see one more time how much range we've got. Yeah, she's like, no, get away from me. Okay, so she's not able to lift up. Do you guys see? I'm poking as hard as I can without getting kicked. Okay. And she has almost no range in her back at all, okay? So she's not able to use that abdominal tunic at all. Her back is so turned on to protect the SI joint, okay? And that joint surface is so locked that we're not seeing any range of motion through there. So if this rider was going to try to get this horse to use its back, to use its pelvis, and to do any form of collection, and I'm not talking dressage collection, I'm talking collection even to be able to step into the canter and have the hind leg actually be able to step forward, okay? Just the ability to collect in the body and do that, this horse is going to struggle. This horse is going to go ahead and use its forehand to pull itself forward to allow the momentum to get its stifles going and then to be able to step forward, okay? So let's start some of our range of motion type work and just see what kind of changes we can make in this horse. Oh, actually, I have one more thing to show you guys that's on your sheet there, and it just about came out of my head. What I'm gonna do is I'm gonna also show you guys the willingness for the muscles of the gluteals and the hip stabilizer to be able to turn on and off, just like I showed you the stifle engagement on and off. So I'm gonna stand behind the horse, I'm gonna grab the tail, and I'm gonna do some quick tail pulls, and I want you guys to watch this region right here on both sides of the horse, okay? Where the hamstrings are coming in to attach and the hip stabilizer. When on a functioning pelvis, when we would pull on the tail, we should see that the muscles of the hamstrings are going to go ahead and fire and turn on to be able to stabilize the pelvis and stop me from pulling the horse backwards, okay? You're gonna notice on this horse, if she read the book, that the left side's gonna turn on, but the right side probably isn't gonna turn on at all. So if you guys on this side are looking at here, and you guys at this side are looking here, okay? All right, so here I am with the tail, and I'm gonna try to keep my big 80s hair out of the way, and I'm just gonna do these little pulls. Okay, so she read the book perfect. Can you guys on that side see that the left side's jumping, and the right side's not firing at all? Everybody? Everybody? Okay. I think they went to sleep after lunch. Before lunch, everyone was like, yeah, I see it. And now you're like, okay. This is the best part, the pelvis, you guys. Okay? So that's really telling us about that she's willing to fire the left-hand side of that tissue, but she has almost no ability or willingness to fire the right-hand side. Okay? So we're going to go ahead now and we're going to start to work through our nervous system stimulation exercises. We're going to start at the top and we're going to walk her in between each time and we're going to see what kind of changes we get. I'm going to start just with the lumbar vertebrae, okay? And I'm going to just stimulate those guys and we're going to try to see if this pelvis will start to gain some range forward. I'm going to lightly try not to irritate her because I have to try to get her to do this 20 to 50 times, right? So I'm not digging and being mean because otherwise the thoroughbred part's going to come out and she's going to say no way. Okay, so I'm just stimulating. Oh, she says, I don't know, you guys. Yes, hugely, oh, my thing turned off. Hugely, no, ooh, oh, I don't know what I did. Nothing, battery ran out. Hugely common thing for horses that are on the track. Hugely common thing for horses that are jumped. And you see it a lot too in guys that are doing a lot of slide stops, okay? So you see this pelvis rolled back like that. But yes, off the track you often see this. We're already getting some licking and chewing. Sometimes, but I got to tell you, in almost all breeds and disciplines that I work on, that the right hind left front is the weak part 90% of the time. Just like 90% of people are right-handed, it seems like a lot of horses have that as well, okay? All I'm doing is right beside the spine in the lumbar, exactly. Staying in the loin, I'm staying off the spine, and I'm just lightly, like really lightly, I'm just pressing down in her tissue, trying to see if she's going to start to allow this pelvis to come forward. And I don't know if you guys that are really watching have noticed, but a couple times she's actually brought it all the way forward. Most of the time she's still super guarded. So we're going to work through this pelvis, and this is going to be a good one for those that were asking, well, how do we know what the problem is? When we do these nerve stimulation exercises over and over, it's going to give us a good idea of what the middle of the onion is. There was a full range. Okay? Because it's going to be kind of the one that we do that gets things moving the best that's going to be our guy. All right. So, oh, that was a good one. Okay, we'll get about 5 more of these, and then we're going to walk her and see what we get. And all you guys know this because you're all horse people, but be amazingly careful when you do this, right? Like she could take me out at any second she would like to with this cow kick, right? Okay, so let's walk her now, Les, to the Wrangler sign and back, and let's see if you guys notice anything in the pelvis. Now, we've just started on a horse that has many layers of things going on, but let's see if we notice anything just yet. Okay, we'll let her go again here and just see. Okay. So, not fixed with the right hand roll, but already significantly different with how far the right hip is headed to the right, okay? So, didn't fix the fact that the pelvis is not moving up and down, didn't fix any of those things, but it did fix some of our cranial and caudal movement. Remember when we watched her before that we had that right hip rolling significantly further forward than the left-hand side. So we know that part of the reason that pelvis is moving asymmetrically like that is because of the tightness that she's got in that lumbar spine, okay? So already worked on part of that. Question?
Yeah, you said that you can get a tear in that head, right?
Yes.
Ligament.
Yes.
In that acute phase, how do you know whether it's a tear and how much do you do at that point?
So if it was an actual injury, like, you know, you saw your horse do the splits, you saw that both back legs go straight out, something like that, that we know could be a direct trauma, the only way we're going to be able to evaluate that SI joint is going to be probably through MRI, unless you have a very good ultrasound vet, because there is 2 ultrasound vets in Calgary that can go all the way down. They have good enough equipment for that SI joint and are doing ultrasounds of the SI. Thank you, ma'am. So I just have to touch it? Okay. Okay, cool. So that would be how you would diagnose it. And then as far as treatment of it, we are looking at, I already got one on that side, we are looking at a huge long hand walk program. Okay, so most SI joints that we rehab successfully are done through hand walking and no weight bearing. Test.
Or would you let it rest?
Totally depends on what's going on with the tear. Yeah, it would be so horse specific on that one.
So does it look like her left hip
Oh.
isn't as high?
Yeah,
Oh, there we go.
Yep.
Sorry?
Does it look, it seems to me like her left hip doesn't go up as high.
Yeah, it's not quite as high, is it? And we're going to fix the rest of that in a second. Okay, gang, let's just get, so you guys can hear me good. I know I'm pretty loud, but, okay, now? Oh, this thing hates me. I didn't touch anything, I swear. Oh. Test. No.
Came on there for a second.
That was weird.
Nothing, eh?
Yeah, I think the microphone works better in this end of the ring than that end of the ring.
Weird. Worked all morning. I think we're going to make it. I'm pretty loud.
Yeah, we can hear it on the
Can you?
broadcast. So.
Okay. All right, we're going to make it.
Okay.
Okay, gang. All right, so that's going to be our first one. Our next one is going to be that we're going to go ahead now. She's rocked forward, hence why I should say this now before we move on. Remember, gang, that this horse's pelvis is rocked back like this. That is why we chose to stimulate the lumbar vertebrae to bring the pelvis forward, right? If this horse would have been a horse whose pelvis is rocked forward, we would have chose to work back here and have her come and have a full range of motion backwards to be able to stimulate that. So I should say that to make sure that you guys have that in your notes, that if there's an SI problem, it's not that you always just stimulate the front of the joint. What we're doing is we're stimulating the movement towards where we want range. Okay, so this horse is rocked back, so we're stimulating the movement forward. If this horse was rocked forward, oh, there, whoa, that's loud. Okay, now I think we're good. All right, okay, I'll be very careful. Okay, so if this horse, oh, now I have to talk soft. If this horse was rocked, we are rocked back. If this horse was rocked forward, we would be stimulating behind the joint to get it to sit there, okay? So we would take our fingers, and I'll just show you that just so that you have it for your notes, okay? All right, we would take our fingers in the gluteal region like this, and we would just drag backwards over and over, trying to get this pelvis to be able to come backwards, okay? So you do need to assess which way your horse's pelvis is sitting. And if you say to me, you know what, after 2 hours of listening to you talk about the SI, I don't know if it's forward, back, what's happening. All I know that it's not right. That's no problem at all. Just get another team member out to help you with your assessment, okay? But if you're pretty sure, like it's easy to see on this horse that the SIs are sitting up out of and the croup is flat behind, and that normal would be down here. Okay, so we know then that the pelvis is rocked that way. So I do want to give you that for your notes to ensure that we're doing that. Okay, gang. So that's going to stimulate that SI joint from the top. The next thing I have to do is I have to stimulate the core tissue and the hip stabilizer from behind. To do that, we're going to do that little quick tail pull that we used. Okay? So we're going to go ahead then, and you guys are going to watch this tissue, okay, in the gluteal region on each side, and she might wiggle around a little bit here, but I'm going to give her these little quick tail pulls, and you're going to see that after about 10, maybe 15, that the right side is actually going to start to turn on. Okay, and she finds this quite uncomfortable, and that's okay. Okay, all right, so we're going to go ahead here and we're going to try to turn this tissue on. She says, no, you're not, sister. Okay, it's okay, monkey pants. Yeah, it will make you feel better afterwards. It will if you let us. Now, this is a great thing to talk about right here. So you guys get home and you have all these new tools to use, and you get home and the horse won't let you. Okay? If the horse is that sore that it won't let you, you are going to have another team member come in. Okay, so she's not going to let us do that one. Okay, you're going to have another team member come in and try to get this horse loose enough and to the point where she's not so sore that she's able to do these things, okay? So if you guys are doing any of these range of motion exercises at home, and the horse is really fighting you, and the horse is not allowing you to do these things, that is a very good indicator for you guys that you're probably going to need a little bit of help, that this isn't just going to be something that she's going to let you do. Now, saying that as well, I might, if she was mine, I might groom the neck a little bit, walk back, do a tail pull. Groom the shoulder a little bit, walk back, do a tail pull. Groom a little bit, do a tail pull. I might sneak them in any place that I can to try to get some stimulation. I would bet if we had some history on this horse that this SI joint has been like this for a long, long time, okay? And so it's going to, be something that's a little bit tender, all right? So it's not, I don't think she's being a bad pants, and I don't think that she's, uncooperative. I think that she's just talking to us. I think she's telling us how sore she is and how hard it is for her to be able to get this exercise done, okay? So for me, because we can't do that exercise, that's not a problem. We're going to move on to the other exercises. And actually, one more time after the other ones, I might come back and try that one again. Question from online?
Yeah, they just wanted to know if magnetic therapy would help with this sort of thing.
Yeah, there's probably going to be lots of manual therapies we could do with this. Massage, acupressure, you could use some magnets on it to increase the circulation. I think probably with this horse, with how much she's got going on in the body, I would be looking at a team member for veterinary chiropractic as well. I'm going to stand on my little soapbox right now and let you know that in my viewpoint, that you need to have a veterinarian do your chiropractor and not a lay chiropractor to do that, just to be safe in case there was a neuropathy that you need a doctor to actually deal with. So I would probably call in another team member on this one. And then I'd also suggest to you that there's one other thing you could try. You could try, because you guys already know that we're doing these stimulation exercises before work and after work. I might try to warm this horse up and work her a little bit. She's a fast twitch horse, right? She's thoroughbred type horse. You're not going to convince her to stand still. She was bred this way for 100 billion years, however long we've been making thoroughbreds, okay, to be able to be like this. So I would also suggest that we might be able to work this horse, and after work she might be better. But let's move on to some of the other areas we want to stimulate, and we'll come back to that tail pull and see if when we have some of the pain response gone out of her body, if she's more willing to let us work on her. I mean, she's obviously getting some releases because we're getting the pretty traditional licking and chewing just from, doing those couple tail pulls. So let's see what we get in the end. The next thing we want to do on her, though, is we're going to move down to the stifles, okay? We know that the stifles aren't working correctly. Yes, the right one is definitely weaker than the left one, but neither side, okay, are functioning well. I'm going to go ahead with my lateral tail pull now, and I'm going to stimulate the stifle region, and then we're going to watch her walk, and we're going to see what we get. Hey, little buddy. Let's try it to the side, okay? So, on, off, okay? And I'm going to do this lateral tail pull here with the tail itself pointed at the dimple of the stifle. And I'm going to turn this on and off. And then we're going to walk her and we're going to see what we get. Okay, and she finds it very hard on this side. Okay, she's barely turning that muscle on at all. That's all she's got for me, and that's okay. You guys are gonna, if you remember from watching the other side, we saw the whole muscle bulge out, and all we're getting on this side is a little bit of stimulation. Okay, but that's okay. Just want to tell the nervous system that we can use this zone. So the things that I expect to see while I'm doing these pulls when we walk her that you guys are going to watch for, we're going to watch to see if we can get rid of that toe first landing. We're going to watch to see that we can start to get a longer stride underneath the body, that this quad muscle is going to be willing to turn on more. And then we're going to walk her towards the Wrangler sign after we do the walks straight in front of you guys. And we're going to see if this stifle doesn't roll lateral so far. Okay, she's really struggling. See, can you guys see that I can barely get it to turn on anymore? Okay, so now we've hit the wall of fatigue, okay? Because I did about 5 there. Can you guys, if you're looking at this region, can you see that it is just, it's not even turning on anymore, okay? So I've hit the wall of fatigue there, all right? So we're gonna give her a second, just like I would do in the ride. I'm gonna give her a second for the muscle to recover. If I give her a second here for the muscle to recover and it starts to fire again, okay, I'll know that I'm not totally fatigued in this region. If when I go to try to get it to fire again after this little break, if it won't fire, I know that we're done. Okay, so you guys can see that it's starting to turn on again after that little break. Okay, so this area did hit the wall of fatigue, but it wasn't totally fatigued. But now you can see that it's hardly turning on again. Okay, all right, let's walk her back and forth in front of the group. And everybody's going to be looking at the right hind leg, and we're going to be looking at how far under the body it comes, and if we got rid of any of our toe first landing. Okay, all right. Okay, so way better as far as the toe first landing goes, and we're not kicking dirt up anymore as the toe comes into the ground. I'm not sure that the length of stride got that much better. I mean, we are into the footprint of the front leg now, but for me, I don't think it changed that much, but I am pleased with the fact that she's willing to pick it up. Okay, next time towards the Wrangler sign. Now the thing I'm really interested in is the width of the stifle. Did we change the way the stifle is rolling to the outside? Okay, and I think that changed more than anything. Okay, I think that stifle looks flatter in the body. Okay, what do you guys think when you're watching her walk away? Okay, I think that looks quite a bit different. Now, this horse fatigued so quickly, if you want to do that walk again, Les. This horse fatigued so quickly that I am not expecting, unfortunately, like the last two horses where we saw so much change. You know, it was just black and white difference. This horse is showing change, but it's definitely not showing change at the rate we saw at the first two horses this morning, okay? Because she is so weak through there. Okay, let's try the stifle on the left-hand side, Les. We're going to do the same exercise, gang. We're going to bring that tail to the side. And we're just going to turn this stifle on and off. Okay, so you guys can see this left side versus the right side definitely turns on stronger. But on a healthy stifle, we would like to see that this entire region will contract, and she's just doing this little line here. But it is stronger than the right for sure. Nothing there. She says, why are you bugging me in my zones that are painful? Okay. Oh, she says, no way, no way. Yeah, not turning on at all anymore. Oh, there we go. Nope, not turning on at all anymore. Okay, so let's give her a little break. Okay, and we'll let the muscle recoup a little bit, and we'll see if we can get some more out of it. But for me, this would be a horse that I would, if she was in my practice, the first thing I would do would be a vet referral to make sure we don't have something more going on. The second thing I would do is this horse would be in a groundwork and exercise therapy program. Turn it on a little bit again.
I gotta tell you something.
Yeah.
The horse just went through a pre-purchase exam.
Oh yeah, and flexed fine?
Flexed absolutely fine exercise.
Okay, cool. That's perfect. All that tells me is that she is ready. She's got the green light for a therapy program. So I would want the vet to tell me that there's nothing bigger going on creating these issues. And if the vet gives us a clean bill of health and all the flexions are good, all that tells me is we're got a green light for exercise therapy. Yeah, nothing. See that, gang? See how she's not willing to turn that stifle on at all? Okay, so we are going to walk her even with those few little stimulations and see what we see. But for me, if this horse was in my program, we would have her on a groundwork, no weight bearing program until we could actually get these stifles to turn on. Because until the stifles are willing to actually fire, you guys, when you're riding her, all we're going to do is drive her to use the front end more and more and more and more, and have the hind end work less and less and less, okay? So this is a really interesting horse to have at this clinic. Okay, let's walk her back and forth this way a little bit and see if we got anything with our stimulation there. I don't see a whole lot. I don't know if you guys see much either. Maybe she's stepping a little bit more forward, but maybe that's me trying to look for something too. Because I think she was in the middle of the track of the front leg when we watched her walk before, and I think most of the time she's landing in the middle of the track again. Let's walk her up to the Wrangler sign, Les, and see if there's any change in the width of the stifle. Okay. Maybe a little bit. There's almost no change, unfortunately, in the hock wobble. And I got to tell you, I don't see a whole ton in the way the stifle's moving either. So this is going to be definitely a harder case because she's going to take a little bit more time. But having said that, let's keep going through our range of motion and we'll just see if she'll allow us to kind of keep working on her. I'm gonna try the tail pull one more time here and just see if maybe she trusts me a little bit more. And if she doesn't, that's totally cool too. We'll get it figured out. So I would really talk to my vets. So I work really hand in hand with a lot of vets, and I would talk to them and see, what they thought. If they said to me, you know what, I have no concerns at all, you go for it, sister, then I would start. If I got the green light from the vet and I started this program, good girl, and she started to degrade or she didn't change at all, then I need the vet to dig harder for me. Get some ultrasounds done, or if the client had the cashola for it, we would send this one for an MRI. Yeah, if they did high and low flexions and they weren't concerned about it, and I physically talked to my vet about the SI joint and my concerns, and they weren't worried about it, I'm going to tick that box off, and I'm going to go ahead and I'm going to start the therapy program on her. So she's obviously, as you guys are witnessing, much more willing to try this after doing the lateral tail pulls. And I know it kind of sucks because she's not facing you guys, but I am getting some stimulation on the right-hand side. You guys can all see the left-hand side jumping up and down, okay? But I am getting some stim on the right-hand side. So this is really exciting for me. So I'm going to stick with this until she tells us to go away, or till I get to about 30 to 50 of these, okay? Because this is really going to help this SI joint, and it's really going to help what we're going to see in the movement. Okay, so if she's going to let us stick with it, we're going to stick with it here. And all I'm doing, gang, is rocking my weight back. I'm not tugging on this like 2 million pounds. All I want to do is stimulate the body to recognize this hamstring tissue and to start to turn on that SI joint. Now this is very interesting. Does everybody see how she's lengthening out? Okay, and she's stretching against me, and she's starting to get some relief from this, okay? All right, so this is often what happens with horses. Ooh, that'd be great if she turned this way. People could see then the back. Okay, can you guys see now, at least the guys that are on this side, can you see that the right hand side is starting to jump up? And it never turned on before at all. Okay, can you guys see that? I'm assuming you're saying yes because I can't see you guys nodding. Okay, cool. I'm going to see if she'll let us get 5 or 10 more of these in, because I'm just starting to get equal jump up on each side. What a good girl. Oh, I like this horse. She's a good trier. Okay, gang, so what am I expecting to see when we walk her off? I'm expecting to see that when she moves, that lumbar vertebrae is going to start to move. I'm also expecting to see that we're going to get rid of the cranial and caudal sway that was so much greater on the right-hand side and have that more equalized. I'm also, she says, maybe you're getting to your end. I'm also expecting to see that we start to see a difference in the flight path of the legs below, and that she's not held so tight in her hamstring region. Okay? All right, so let's walk her less and see what we get. We can go this way against the crowd first, and then away. Okay. So looking at that pelvis, can you guys see now that the lumbar vertebrae and the pelvis is actually starting to move up and down? Like for me, that's a huge change from how she was before. Okay? Can everybody see that in the lumbar there, that it's actually moving up and down, and it did not move a lick before? Okay? Now I'm going to put my eyes down. Maybe some of you guys already did, but now I'm going to look at the legs. Yeah, totally. And the flight path is a little higher, isn't it? She almost looks to me what I would call a little ataxic behind now, which means she doesn't quite know where to put her feet. And for me, with SI stimulation, that's not unusual. Okay, do you guys kind of see what I'm seeing, where it's almost like she's a little not quite sure where she's putting her feet. Sometimes she scuffs the ground, sometimes she's doing toe first, sometimes she's doing a nice stride. And it should be that the more Les walks her, the better it gets, because the nervous system should be recognizing the body better. Okay, Les, on the next one, can you go from the camera to the Wrangler sign? I don't know if you guys can hear, but she's cricking and cracking behind that she was never doing before. Okay, so huge difference in the pelvis. It actually moves to the left now, where it never moved to the left at all. Okay, so like that's night and day for me in that pelvis, like huge difference, okay? Now I just looked at the pelvis, I didn't look at the stifle, so let's look at the stifles the next time. Maybe some of you guys already did and I'm behind you, but I was so excited about the pelvis I could hardly stand it. I'm probably more excited than you guys are. Okay, so the hawk wobble is probably down by half, okay? And the stifles are way straighter, okay? Now the hawk wobble's still there. It's not fixed by any means. We need to get the hamstring tissue worked out and that kind of stuff to get a change through there. But that's a huge difference from side to side with that pelvis, okay? So that makes me really happy. If the owners of this horse, if the horse will allow her to do those tail pulls, and maybe we'll suggest that they do a bunch of the other stim exercises first and the tail last, it would make a big difference for this mare. Okay, so now, gang, we're going to do the last bit of the ring of muscles for behind. We're going to try, if she'll let us, we're going to try to do some tummy lifts, okay? And we're going to see if then we can get the rest of this back moving, and we'll just see. Okay? We'll just see if she's had enough of me yet, or if she's going to let us. Okay, bud. Ooh, she says, I don't know. Ho, ho, ho. Good girl. Good girl. Good girl. Good girl. Good girl. Oh, she finds it so hard, you guys. Oh, but she's so lovely. She does try. Up, up, up with that back, missus. Up, up, up. There she goes. There she goes. She's trying. Good for you. I hear you, sister. I hate sit-ups too. Good for you. Good for you. Good for you. I know. I know. I hate sit-ups too. Good for you. That was a great one. See, this horse is a great trier, whoever has this horse. This horse is a neat horse. Up, up, up. I know. It's brutal, she says. It's brutal. That's a good one. That's a good one. Can you guys start to see that she's actually starting to lift her back? Good for you. It's hard though, boy. It's hard. Her quarter's just about run out. I hear you. I hear you. I hear you. Yeah, good for you. Good for you. Yeah, look at that. Nice. Good girl. Good girl. Good girl. So you guys can see that it takes a little determination on some of these guys that are this sore. Good girl, you're trying. Give me 5 more. Give me 5 more and I'll stop poking you. 1. Come on, you can count to 5. I've seen you. 2. Come on. Yeah, good for you. 2 more. Good for you. 1 more. Okay, let's watch her walk now, Les, and let's see just if we've got a little bit better movement in that pelvis. Remember, we're trying to turn on the ring of muscles. We're trying to get that SI joint to relax and get a little flatter, and we're trying to get movement in the top line that we never had before. Okay, so even with that little bit of abdominal stimulation, can you guys see the back starting to change? Like, that's a big change in the way that the back's moving, okay? And she didn't let us do that many of those, but this horse is a great trier, okay? Great trier. All right, so we have a big difference through there. I just want to see now, we're probably got our quarter pretty much run out. But the next time when she comes by, I'll get Les to stop her. I'm going to try to bring that pelvis forward, and I'm just going to see, because remember, we had hardly any movement there when we started all these movement assessment exercises. We had hardly anything there. I know, but here, I'm like the pokey lady, aren't I? Okay, I'm just going to see if I drag this pelvis forward. Yeah, you guys see that range we're getting? Okay, huge difference, okay? And all we did was a little bit of stuff. Okay, so this horse is an excellent example of how a horse, you know, that seemed too sore to do anything. You're fantastic. I like you. Okay, too sore to do anything. With just a little bit of nerve stim like that, we can make such a huge difference. Okay, and I would imagine, now I could be imagining it myself. But for me, the pelvis, maybe even the hunter's bump looks a little bit flatter, but I could, yeah, you think so too? I think that, you know, in 2 or 3 days of doing this, I would say that you will have that pelvis coming forward more and more and more. Yeah, I think even that angle, it really looks flatter. So I think, you know, if we can just get this pelvis moving a little bit, we can make such a difference with this horse, okay? All right, gang, did I miss anything? Let me just, because I'd like to get that other pelvis back out for 1 sec. Just let me make sure, because sometimes I get yakking and then I did miss that is something I want to make sure I say. There is something, gang, that they're going to call in osteopathy and some chiropractic schools, they call it the half-witted brother syndrome. It means that whatever the SI joint is doing, the pole is doing the opposite, okay? So whenever you have these horses, and I wrote that in the sheets for you guys, but whenever you have these horses with problems in the SI joint, okay, you're probably going to have the opposite problem in the pole, and you do want to make sure that you guys as trainers check that, or at least you're aware of it. And a lot of you guys that ride horses like this with a little bit of a frozen SI will probably say to me, yeah, you're right, you know, he's really hard to get flexed in the pole, and it's really hard to be able to get any pole, either longitudinal flexion or lateral flexion on these horses. Okay, so that is something that we should mention about horses with SI pain. And it's pretty well documented in humans, not as well documented in horses, but I have found in my practice that it is often there. So on this horse, before we put her away, because I was hoping to save the last little half an hour just to go over that one other pelvis that, yeah, perfect, look at me and my timing. That other pelvis, because this one was rocked back and I wanted to be able to show you something that actually moved forward. So we should do the pole on this horse before we give her back to her owners. So we had a low pelvis on the right-hand side, okay? We had it slightly forward on the right-hand side. We should then have pole pain or jaw pain on the left-hand side, okay? So we're just gonna go here, and she's like, oh, hi, pokey lady. I know, but we're going to make you feel better in the end. It's poking at the beginning, but better in the end. Yeah, you're quite nice. I like you. Okay, gang, so I'm just going to go here in front of the first cervical vertebrae behind the skull, and I'm just going to, palpate. She says, no, you're not. Okay, in here, and you guys can all see super reactive pole pain there. I'm also just going to palpate that TMJ joint, which probably lots of you trainers do already. Actually not bad for TMJ pain on that side. Thanks, Les. Okay, TMJ pain on this side, nothing. Pole pain on this side, yeah, pretty much nothing. Maybe a tiny bit there when I first put my thumb in, but I'm grinding pretty hard and she doesn't have too much reaction in here. So she's pretty typical for that, what they call that half-witted brother syndrome. Okay, you guys remember what we do to try to get that pole moving a little bit? Okay, we do the nod, right? Okay, so we're just gonna do a little bit of nodding on her. And what we're gonna watch, instead of before when you guys were watching the front end, we're gonna watch the hind end this time again. We're gonna do the pole nod and we're gonna see if it changes the SI joint, okay? And we're gonna see if it changes the hip behind, okay? So all we're gonna do here, hi Mrs., okay, is, I know. I'm just gonna gain a little bit of trust by starting super slow. She's like, I don't want you anywhere near that. You poked me and it hurt. I know. We might need your tallness less to do the pole nod. There we go. Oh, good girl. Good girl. So we'll just gain a little bit of trust by doing our nod here. Nice. Ooh, you're a good girl. I like you. Yeah, good licking and chewing. So again, I'm just going as far as she'll let me. Okay, creating some mobility in there, stimulating the nervous system, telling it that it can turn on and off. I will let you guys know as I'm doing these, please don't think to yourself with nervous system stimulation, don't go to the North American thought process that more is better. You know how all of us here, we think, oh, well, if they told me to take 2 Advils, I'll take 3 and that'll make me feel way better. Or if they said that I'll get strong doing 10 reps, I'm gonna do 90 reps and that'll be better, okay? So it's important with this kind of stuff that you don't force the horse to a range of motion that it can't take. Just because we're trying to get range of motion doesn't mean that you have to crank her head off of her body. You just have to do what's comfortable for her, okay? And she's allowing us to do more and more, which always happens with nervous system horses. Nice. Who's the smarty? Who's the smarty? Maybe I can sneak you home in my truck. I quite like you. I think we could fix you easy. Yeah, you're kind of fun. All right. Okay, so let's watch the pelvis, okay? So this is just something for you guys to think about. We're going to watch her walk again, Les. And we're just going to watch the pelvis after we created some range of motion in the jaw. Okay? Just see what we can see in that pelvis. Look at that pelvis bounce up and down. Hey, gang? Okay, that horse could not move like that when we started. All right? Really, really different. I don't know if it's that much different from doing the pole nod, but I have to say, because I found it so much that I'm going to send you, I did put it in you guys' sheets, and I'm going to send you home with it. I think it's an important part, okay? But look at that pelvis go, okay? Can we do maybe 1 up to the Wrangler sign or 2 up to the Wrangler sign, Les? And the guys at home will be able to see what really good. Okay, hawk wobble still down, pelvis way straighter, hips moving better, okay? So now, is she miraculously perfectly sound and fixed in 15 range of motion? No, of course not. This is going to be for you guys to take home and use. Will she be back to her stiff self tomorrow? Probably. If we do this tomorrow, should we be able to get further into the work than we got today? We should be able to, especially if she trusts you. If you do this for a week, will we see more and more change? Yes. Do I think that we can fix this horse without any body work? Probably not totally, because we didn't get rid of the hock wobble and we didn't get that SI joint to magically come flat. I mean, it's a lot flatter than when we started, but it's not better, okay? So does she need more work? 100%. Am I expecting that you trainers are going to be able to go home with a few of these nerve stim things and make every horse you have in your barn absolutely perfect? No, because it's a team that makes any horse be able to function, right? But, thanks Les, but I can tell you that if you guys do this stuff, do you think, Les, we could get that gray again? I just want to show that pelvis just so that we could see, because this one was so rolled back. I just want to show one that's a bit flatter. I do want you guys to be able to know that even with just this little bit of work, you guys could go home as trainers and make huge changes in this horse. If you were to ride this horse before we did all that nervous system stimulation exercises, she would have started off really tight behind, really tiny behind, dropping that right hip, dropping that right stifle, not able to take the left lead as good as the left or right lead, all the things that are involved with that right hind leg, okay? If you guys take that little bit of time, okay, to be able to get these horses so that they have that little bit of stimulation in their body and the nerves are already starting to be turned on, I can just about guarantee you that your ride will be so much better, okay? So I'm not trying to like sell you a miracle here, but I am trying to get you guys to be able to kind of see how valuable this stuff is just with a little bit of work. So remember this guy when we evaluated her back and we saw how sore she was all the way along the spine, okay? And I said to you guys, please ignore her pelvis for now. I'm glad that we have an extra 15 minutes here to be able to go through and talk through this pelvis a little bit. This horse is also has a asymmetrical pelvis, and I'll show you her from behind in a second. But when we look at her SI joint here, okay, I wanted to show you what range of motion should be. So see how on a horse that has range, when we go to push down on this, we can make the whole croup flatten forward. Now I would expect if we did some stim exercises on her that I could get this back bit to be totally flat too. But all I'm doing, gang, is taking my fingertips and I'm just pressing it into the tissue, okay? Off of the bone, just press down, okay? Then we're gonna check her range of motion from behind. Okay, so all I did was run my fingers all the way down to the glutes here. Some of you guys, I've seen you guys do this one where you do these fast circles right here, okay? Pardon me, we have to be careful with that one because all we're doing when we do that one is we're just stimulating one muscle group, which is the hamstrings. And you can have a little bit of a ballistic response, which means the response in the SI joint is too quick, and you can create some SI pain. And there was even some talk on a couple studies on if you could create a tear in your SI. So please make sure when you do these range of motions to check what's happening, that you do them very slow and very calculated. You never want to do a range of motion anywhere on your horse that is quick or has any joint surface going in a ballistic type motion like that, okay? Anytime you see people do that, suggest to them that maybe when we look at a joint surface that it's not meant to be forced into a quick shape like that, okay? The other thing that I couldn't show on that horse because of how off her pelvis was how to check the pelvis laterally, which is why I wanted to get this gray guy back out. So Les, if you put the hip towards them, I'm going to show this on both sides, so both kind of sides of the stands will be able to see it. I want to be able to bring the pelvis to the side. When we look at this horse, she does have a little bit less on the right, but she doesn't have a huge asymmetry like that other horse had. The other horse wasn't able to move at all in the lumbar vertebrae, so it wasn't really fair to bring her to the side because she would have just had so much pain with it. I'm going to now reach across to the opposite side in the gluteal region, and I'm just going to stripe towards myself, and I'm going to bring this pelvis over to this side, and I'm going to see, look at what lovely range of motion she's got to the side, okay? So really good girl there, okay? Lovely there. I'm going to go around to the other side so you guys can see as well. Here's my fingers in the gluteal region. Now, if this guy read the book, we shouldn't have as much range on this side, because if you guys remember, this was the side that we had the dropped rib cage on. So here I go, and I'm going to go ahead and stripe this way. Come on, baby cakes. Atta girl, atta girl. Oh, she's a lovely trier. But that's about the end of our range, gang. Can you see the difference from side to side? Okay, and I can try, no. One more time, bud, more? Do you have any more in you? No, she says I'm stepping out of it, okay? So can you guys see the difference in the lateral range of motion, okay? The reason why, thank you very much. The reason why we didn't show that on the other horse was because it was, number one, obvious which way her pelvis was rotated, and number two, would have been way too tender, you know, and she would have found that a pretty good pain response, okay? So if I can tell something by just looking, I don't need to do the range of motion. But for you guys on horses where you go home and you say to me, well, you know what, the pelvis looks pretty good. Like, I think this pelvis looks pretty good. They've all got something, gang. You know, they've all got a little something. So it's not like we're gonna, I've never seen one in 21 years ever that is absolutely perfect. Even some of the great big $1.60 million guys, okay, they're not perfect. But when you do these range of motion, it's going to tell you a lot about what's happening in this pelvis. Okay, so she's not able to come to this side. What exercise did I give you guys to try to bring the pelvis to the side a little bit? It turns the stifle on the side you're working on, but it also stretches out the pelvis on the side. That lateral tail pull, right? So let's, with our last little 5 minutes here, let's do a couple lateral tail pulls on this guy and see if we can get this pelvis to move a little better. Actually, before we do that, we should watch her walk, because we watched her walk before, but we were looking at her back. Let's watch her walk less, back and forth a couple times. And this time, you guys, we're going to look at the hind end. And we're going to look at how the hind end moves up and down, which, see that nice up and down that the other horse didn't have? One side, one side, one side, one side. Nice pelvis there, okay? But we do want to look at those hind legs, okay? And we want to see that pretty clearly every time the left hind toe digs up a bunch of dirt, right? Okay, is everybody seeing that? Every once in a while the right hind gets it too. But she's super consistent, okay, on that left hind. Does everybody see that? Okay. Let's do, let's less walk her so the guys at home can see well, and these guys too towards the Wrangler sign once. And just have a little look. This is a horse with a pretty, you know, pretty good pelvis. We've got a couple little small things, but look at how the pelvis is bouncing up and down. Very nice, okay. All right. Got a little bit of hawk wobble, got a little bit of wide stifle on this left side, but I'm hoping with this stim exercise we're going to give you guys, we're going to get rid of lots of that stuff. Okay, let's bring her in here, and I'm just going to do that lateral tail pull, okay? All right. Okay, so remember, gang, the pelvis wouldn't come this way, right? So I'm going to try to stretch out this side of the SI joint. I'm going to do my lateral tail pull, and then I'm going to do my backwards tail pull to stimulate that top of the SI. And we're going to see here if we can make a change. So look at this lovely stifle turning on and off. Can everybody see the difference between this horse and the last horse with how that stifle's turning on and off, okay? Much stronger quadricep muscles on this horse, much stronger ability to fire on this horse. Oh, she says, I don't love this. Okay, give me about 20, 25 of these. Remember, anywhere from 20 to 50 is going to be you guys' reps on these. Nice. Okay, and then we're going to go with these straight back tail pulls. And while I'm doing this, let's just chat just briefly. I know I'm almost out of my time, but I did want to mention one thing about quadriceps. If I was going to choose one muscle on the horse in every discipline of horses that I work on that is weak, it is the quadricep muscle, okay? It is the muscle that brings the leg from the stifle and protracts it forward, okay? There's obviously a group of 4 of them, hence why they're called the quads, okay? And for me, that is the place in the body that is the absolute weakest. It's okay, monkey. It's okay, monkey. What a girl. I find that it gets very weak because most of us don't ask the hind legs to come nearly deep enough underneath the body. And there's a really interesting mechanism in the horse that when they go to fire the hind leg, there is a reciprocal apparatus that brings the leg forward after, okay? And it's called your the major muscle component of it is your peroneus tertius. There's a couple other guys too. But that little guy in there is a little bit of a rascal to us because when the leg goes back into extension, all right, we'll have to, I'm going to push pause it on my peroneus tertius for a minute and let's watch her walk. And then I'm going to do the range of motion and then I'll finish that quad thought in a second. Ooh, I pulled some tail out. Sorry, guys. Okay, still stabbing the ground with the left hind for sure. I would have loved for that to go away, but it didn't, so we've got something else going on with this guy. Okay, but pelvis is definitely moving better. Let's bring her back over here with her butt facing the guys, and let's do our range of motion on this side. Perfect, thanks. Okay, see what we got. Okay, oh, she says, you don't get much time with it, sister, but, and she steps right out of it, but already have like night and day range of motion than we had before. Same pressure, same way of asking, okay? Huge difference from side to side, see that? Okay? So we can make a huge change with these simple little things that I'm going to send you home with. Okay, gang? Really wanted to show you that second pelvis because we had so much going on with that one. So let me just finish your quad thought here quick when you guys are considering strengthening quads. There's a reciprocal apparatus in the horse that when the horse uses its hamstring tissue and it contracts it, the body has a recoil system to snap the leg back forward, okay? Most horses that are working, you guys are going to notice, have only that as the leg comes forward, okay? When the leg is back, you see the toe come off the ground and then the reciprocal apparatus turns on. Now, after the reciprocal apparatus turns on and the leg starts shooting forward, the quadriceps muscles should turn on and the leg should come up and forward and extend like that. Most all horses, and this horse for 100% does not turn her quadricep muscle on at all. Hence why she goes into the dirt and makes that dirt kick up, okay? And also why, when you look at her just in general, that you can see that she's cupped out here with not very much tone in her quads, and she's got all this hamstring tissue, okay? So it's clear that these guys have been working this horse, but the quadricep region is not working, okay? So we need to change that on almost all horses, okay? The only way to change it is to stimulate the leg to actually have to bring the leg forward. And the way to do that is to walk over poles and cavalettes. And I know for some of you Western guys, you're gonna say to me, I'm not a jumper rider, okay? I don't need to go over poles and cavalettes. But you guys can rename them whatever you want for your world, but I need you to do poles and cavalettes until you're purple in the face, okay? And then do a couple more poles and cavalettes and let me know how your horse is moving, okay? Poles and cavalettes are a key for any performance horse. Any horse that has any problems behind, any horse that's got any SI problems, any horse that has back problems, all of those horses normally have low quadricep muscle. And if I could preach anything, when any trainer says to me, if there's one thing I can do with my horse to make it better, on all multi-disciplines, it's going to be to target the quadricep muscle, okay? Because most horses have low quad tone, okay? And it's really affecting your horse's back and SI.
So a horse that's not fit, that you're just starting, and it drags both
Yeah.
its toes to the dirt, is that?
That's quad tissue, yep. It's also going to be SI pain and core stability strength, so hip flexor strength and core muscles in the back. But those things all combined together. The fastest thing that's going to build is going to be your glutes and your hamstring tissue. That's going to build the fastest.
So as you're seeing him and say 2 months down the road, you still have some of that toe dragging, like in the trot.
Yep.
So then you start doing more pulls and
Yeah, more pulls and cavalettes. We probably on a horse like that you feel like, do you feel like it got better, or do you feel like it stayed the same no matter from the first day of riding to the 8th week of riding? Was it the same, or was the toe dragging better?
It was better. But
Yeah, but it's not gone.
No, it was better, but it's still, you can still see
Yeah,
it. And
okay.
so you think,
So sometimes toe dragging, sometimes toe dragging is hock pain, for sure. So we might have another team member out to double check for hock pain, because whenever I've got a toe dragger, that's one of my thoughts is there any hock pain? But my other thing is probably that it's hip flexors, quad tissue, and any of its ring of muscles are not firing properly. So if you did all of these stim exercises that I gave you for the back, the SI joint and the stifles, and you started a pole and cavaletti program, and in 4 to 6 weeks of that, you said to me it's still toe dragging, then for sure we need another team member on that one to make sure that there isn't something else going on. But lots you can do usually with those toe draggers. And I'd want to see a little horse like this that's really a great little horse but has a couple little problems with it that stuffs its toe into the ground quite a bit. I'd want to see this horse change in 4 weeks for sure. Yeah. If you could do your poles and cavalettes, if you worked your horse 6 days a week, so my very favorite program for all my big riders is 3 days on, 1 day off, 3 days on, 1 day off. I have them rotate through where we do the first set of 3 is cardio strength cardio. I put my poles on my cardio days. So on that little set of 3, there'd be 2. Then I'd have a day off. Then my next set of conditioning would be another set of 3, but it would go strength, cardio, strength. So then I would put my poles on my cardio day once again. So in a 6-day week, you would have those 3 days of poles and cavalettes in there. Unless I had a horse with some kind of anomaly, like the gal talking about this horse that's a constant toe dragger. For those horses, I put poles in their paddocks, I put poles in their stalls, not at night so that they can sleep, But I have some trainers that don't turn horses out, so then I have the grooms put poles in the stalls so that when they walk to their hay bag, they have to walk over them and that kind of thing. Horses that are like that horse that she's describing, I put poles everywhere so that their whole world is turned into poles, yeah.
This is so cool that I just learned this. But I've seen, he's a big horse too, he's like 16-1, but I've seen him in the field do a turn on the haunch, because, you know, he gets it in his mind that's how he's supposed to turn, instead of in the field with his friends, just turning. I've seen him do a turn on the haunch in the field to turn and just fall down.
Oh, yeah, so that's probably stifle, yeah.
He's not picking up his back.
Yeah, yeah.
It looks like he's lazy.
Right. Cool. Well, I'm excited for you because I think you could use a lot of this stuff on them. Yeah.
I've done poles with him, and last summer, and he just trips over them.
Right. So start on the ground, right. For safety, start on the ground for sure. And you need to put your poles so that they're about fetlock or mid-cannon height so that he actually has to do something, yeah. And really watch for fatigue. Because if he gets tired behind, you'll see him, and he'll be like that horse when we treated her, and she was a bit ataxic after, right? She was like stomping the ground. Okay, so you got to really watch for fatigue on that guy.
Does hill work come in this at all?
Yeah, hill work is fantastic as long as it's got great footing, you know, that we're not slipping and all those kind of things. But yeah, hind end stuff, SI, stifles, excellent hill work up, okay? Anybody with SI pain cannot do anything but walking down a hill because it puts too much concussion on the spine. But when you walk down a hill, I always get my clients to leg yield back and forth in a zigzag pattern down the hill, and then you'll get the abdominal stimulation from the hill going down sideways, and then up, trot, and canter. Yep, very good point. Okay. And all those ridden exercises are listed in you guys' sheets there, okay? So I did put those full exercises of ridden exercises in your sheets. Any other questions on some of this nervous system stimulation stuff? I'm hoping that all of you guys work with a good body worker and veterinarian to be able to help you with any of these problems. Make sure that your body worker is fully insured and is a member of an association that allows them to have a code of conduct that they have to work towards. That will ensure that you guys have the quality of body worker that you guys want. Okay, so that's my little soapbox thing there. And I guess if there's no other questions, we're all finished.
All right, well, thanks so much, you guys. Hopefully you enjoyed Tina's session. I just want to give her a round of applause because I thought it was really good.
Yay!
And thank you to Les, too, for being our horse holder
Yay!
all day. I wanted to give you this to thank
Oh,
you for
great.
coming.
Thank you.
Thank you so much.
Thank you.
I'm sure if they have any questions, are they able to?
Oh yeah, you can like my page on Facebook and email me there. You can go on my website, inhandequinetherapy.com, if you have any questions. Yeah, totally.
All right, guys, well, we're going to take a quick 15-minute break. There's coffee upstairs, and then our next session with Amanda for nutrition is going to be in the classroom upstairs as well. So she's set up there, so we'll just get everyone to kind of take their time and head up on that way.
Perfect. Yay! Thank you.
Thank you.
Okay. In hand.